My name is Maria Robey, and today I'm going to be talking to you about pancreatic cancer. I'm going to be speaking to you as if you were high school students. We will cover several topics of the cancer, and then the students will have to complete different assignments to make sure that they have understood everything thoroughly. There are three objectives today that we will cover to make sure that the students are thoroughly understanding the material. The first is, after watching a video about pancreatic cancer, the student will take a quiz with 100% accuracy. The second is, after a PowerPoint lecture given from the instructor, the student will work in pairs to accurately list 5 symptoms of pancreatic cancer. The final objective of today's lesson is, after a PowerPoint presentation, students will complete an exit slip listing 3 possible causes of pancreatic cancer. Each of these is to ensure that the student is understanding the material throughout the lesson. We're going to go a little bit out of order in the objectives today, so just bear with me. We're going to start with our PowerPoint presentation. So we are going to start about what is pancreatic cancer exactly. Pancreatic cancer is a disease in which malignant, otherwise known as cancer cells, form in the tissues of the pancreas. The pancreas is a gland located behind the stomach in front of the spine. It's kind of right under your sternum. The pancreas produces digestive juices and hormones that regulate blood sugar. Cells called exocrine pancreas cells produce the digestive tissues, while the cells called endocrine pancreas cells produce the hormones. The majority of pancreatic cancers start in the exocrine cells. These cancers they multiply, so they start with a certain cell and they multiply. The problem with pancreatic cancer is that these cancer are not really found until these cells have moved throughout the body. Each individual organ has its own purpose, so the pancreas produces all your digestive enzymes. Well, these cells get their own mind, the ones with cancer. They have their own mind, and then they start spreading throughout the body, causing the body to not do what it's originally intended to do. This is when the cancer has metastasized. Often that happens in pancreatic cancer patients, and the cancer is thought to be somewhere else at first. They originally think it might be in your liver or in your stomach, but then they realize it comes from your pancreas because these symptoms might present elsewhere. Next, we are going to go over the symptoms of pancreatic cancer. Oftentimes, the symptoms can be related with another problem going on in the body. That is why most doctors don't automatically assume pancreatic cancer. Some of the symptoms include jaundice, oily stools, pain in the upper or middle abdomen or back, unexplained weight loss, loss of appetite, fatigue, and depression. As you can see, these symptoms could go for a lot of different things going on. So it is important, if these are not symptoms that you're often having and they're new in onset, that you contact your doctor right away to make sure that this isn't something else, such as pancreatic cancer. This is a picture that I found from the Pancreatic Cancer Action Network. That is the site that funds and helps raise money for pancreatic cancer and also gives survivors or people experiencing this new disease to themselves can go and get information and resources. This picture shows all the different symptoms and how they could be newer onset. I'm going to leave this picture up for a couple of seconds so you can really look at it and understand the symptoms and how they differ from other diseases or problems that someone could experience. At this point, you are probably wondering what causes pancreatic cancer. There are a few things that can make you more susceptible to the disease, such as smoking, being overweight, alcohol consumption in excess, diabetes, frequent pancreatitis, or inherited immune disorders. Once your doctor suspects that you have pancreatic cancer, he may do one or many different kinds of tests to see what stage it is at and confirm the diagnosis. The most common one is a CT scan, but they can also do an MRI, endoscopic ultrasound, laparoscopy surgery to view the organ, or a biopsy. Prognosis for cancer patients with pancreatic cancer is not that great. The American Cancer Society reports that only 23% of patients with the exocrine pancreas are still living 1 year after diagnosis. Only about 4% are still living 5 years after being diagnosed. Pancreatic cancer has no early detection. Once it is caught, it is usually too late, and it is the most underfunded cancer. Therefore, it doesn't get much attention. There are treatments for pancreatic cancer, but since it is usually not treatable, they aren't very effective, but they may help minimize the symptoms. The symptoms include a full or partial removal of the pancreas. That is called a pancreatectomy. That is often not done because it can kill the patient who is so far along in their cancer. Chemotherapy, radiation, and clinical trials are often used to help the patient and maybe even give them a longer prognosis. We have talked about how deadly pancreatic cancer is, but I'm sure you are wondering why. Pancreatic cancer tends to be discovered late in the course, and it frequently has spread to other organs. Surgery can be performed to remove the tumor or parts of the pancreas, but it can only be done if there is no evidence of spread. Most people with pancreatic cancer are not candidates for the surgery. It is really the only chance for cure for this kind of cancer. Even with the surgery, the cancer can recur. Pancreatic cancer is not responsive to other treatments like chemotherapy or radiation. Chemotherapy has some benefit, but it is modest at the best. The disease spreads throughout the body, and it causes lots of pain, and most people are very uncomfortable. And by the time it is discovered, they usually only have a couple months to live, and at the most a year, oftentimes. Now that we have gone over the PowerPoint presentation for pancreatic cancer, I'm going to ask the students to get in pairs and get a piece of paper out. You two need to come up with the symptoms of pancreatic cancer, at least 5. After that, please give it to me and we will move on to the YouTube video. I'm going to ensure that you are listening and understand what are the symptoms of this disease. Now that you have all handed in your papers, we are going to move on to the YouTube video. At this time, I ask that you put all of the materials away and please pay attention to the video as it will give you knowledgeable information.
Well, cancer is really cells growing out of control. So when a cell grows in an organ, it's controlled by the organ. It's told what to do. It says, you're part of the liver, you should develop into a liver cell, and this is what you should be doing. Similarly, in the pancreas, you're supposed to be a pancreas cell, this is what you do. But in a cancer, the cell develops a mind of its own and just starts to grow out of control, out of organization with the rest of the body. And because it really isn't influenced by the rest of the body, it just continues to grow. It doesn't do anything useful, and just simply through growing, bits breaking off and spreading and growing elsewhere, it replaces and consumes those organs that we need to survive.
The pancreas is an organ which lies at the back of the abdomen. It passes from here across to here. It's shaped a little like a fish with a head, body and a tail. It lies in the duodenum where it produces pancreatic juice. It has a beautiful orangey yellow colour to it, and it's soft, yet it is a very powerful organ because it makes enzymes which digest your food and also makes insulin to help you metabolize that food that you've digested.
Pancreatic cancer is usually a single tumour which originates in the pancreas but then can spread elsewhere. It can either spread to the lymph glands close to the pancreas, which we can still take out with an operation, or it can spread to the liver or the lining of the abdominal cavity called the peritoneum.
The important cancers of the pancreas are called adenocarcinomas, which means they come from the duct cells of the pancreas. And these cells arise in the ampulla or the opening of the pancreas, but mostly along the main duct of the pancreas. They tend to, for some reason, be able to grow more quickly and to migrate more quickly than most other cancers in the body.
We found 2 big tumors in my liver, which were the size of a tennis ball, and so we decided to do a biopsy after that. And after the biopsy, it was confirmed, yes, that I have endocrine carcinoids and that I have cancer, which started with the pancreas being the primary and metastasized to the liver.
So this mode of spread is called metastases, which means moving to a different site. And so individual cells of the tumour shed off and they lodge in other organs such as the liver, and then they continue to grow. And so whilst it is still pancreatic cancer, it now is in the liver. When we diagnose somebody with a pancreatic cancer, in order to decide what sort of treatment we're going to do, we have to do what's known as staging, to identify which stage the cancer is at. Is it as an early stage? Is it confined to the pancreas? Can we do things like surgery? Is it a little bit more advanced but still in the area of the pancreas, which means we can't do surgery, but we can use other things?
For patients who have a locally advanced non-resectable cancer, we usually give both chemotherapy but also give radiotherapy throughout the treatment.
Or has it already spread somewhere else like the liver, where neither surgery nor radiotherapy is really going to help, because just taking out the origin of the cancer isn't going to help because it's already spread. And so in that instance we use chemotherapy.
When Mum was first diagnosed, she told me that the doctor said she would only live for about 2 weeks, and and she was in absolute shock because she said, I didn't even feel sick. And then once they looked at further tests and scans and things, they were able to see that the tumour hadn't spread anywhere else, so they said they modified their prognosis to about a year. And as it turned out, Mum lived for 3.5 years, and she lived pretty well for most of it. She had a reasonable quality of life.
Generally with pancreatic cancer, it's got a bit too far by the time it's found. But they could have told me, yes, you can beat it, it is possible. It's not necessarily a death sentence. I was 50 and being told I'd be dead within 6 months. And I just wasn't prepared for that.
Actually, when I first told my boss that I had cancer, she really couldn't believe it. She said, you are one of the fittest person in the office, you know, all the other young men, they fall down like flies.
Unfortunately, the main risk for pancreatic cancer is bad luck. We don't really know enough about most of the cancers that develop. They just develop for a reason we don't understand. We do know that about 1/4 of pancreatic cancers probably develop as a result of smoking, and smoking is certainly a risk factor. Another risk factor is pancreatitis, or more specifically chronic pancreatitis, which is an ongoing inflammation of your pancreas. We know that diabetes is associated with pancreatic cancer, but it's not necessarily a risk factor. It may be something as a consequence of the pancreatic cancer or something that develops together. But unfortunately, the majority of pancreatic cancers don't occur as a result of direct risk factors.
For patients who have pancreatic cancer, you need to be aware there's lots of support services around, and that you should not feel isolated through this journey.
Now that the video is over, I will hand out your quiz. When your quiz is done, please turn it in and go back to your seat. Take out a piece of paper and write down the 3 possible causes of pancreatic cancer and hand it in. This is your exit slip. After that, you are free to leave. But please remember everything you learned about pancreatic cancer today.